The emergency room used to hum at 3 a.m. That harsh fluorescent glow meant someone was still awake, still ready to stitch you back together. Now imagine that hum going quiet. The sliding doors don't slide. The monitors are black mirrors. The last doctor on your block admits she can't help without power, without supplies, without backup. In 12 hours, your last antibiotic pill expires. Suddenly, every minor injury becomes a coin flip. Every infection becomes a death sentence. Most people will wait for the cavalry. Those people bleed out on their kitchen floors. You're going to realize you've been sitting on a field hospital this whole time. Here's what nobody tells you. Emergency medicine isn't magic. It does 5 things. Stops bleeding, closes wounds, prevents infection, manages pain, and buys time. Everything you need is probably within 15 feet of your toilet right now. Let's turn your bathroom into a trauma bay. Honey, the ancient antibiotic. Raw, unprocessed honey. Not that corn syrup pretending to be honey. Honey has treated wounds for 4,000 years. Modern hospitals still use it for burns and ulcers. The sugar content sucks water out of bacterial cells through osmosis. When it contacts wound fluid, it produces low-level hydrogen peroxide. Sustained, slow-release disinfection. Clean the wound first. Spread a thick layer of honey directly on the injury. Cover with a clean bandage. Change daily. Burns, lacerations, even infected wounds. Honey handles them. Honey on a dirty wound just gives bacteria a sweet place to hide. Clean first. Always. Dental floss, the surgeon's thread. Unwaxed dental floss is thin, strong, and handles tension without snapping. When a wound won't stop gaping, this is your suture material. Sterilize a sewing needle in flame until it glows. Soak floss in rubbing alcohol. Simple interrupted sutures. In one side, across the gap, out the other. Tie off, cut, repeat. 1/4 inch spacing. It won't be pretty. You're preventing someone from bleeding out, not winning a beauty contest. Never suture bite wounds, punctures, or anything infected. Those need to drain. Closing them traps bacteria inside, and that's called sepsis. Super glue, the liquid stitch. Super glue was used on battlefields in Vietnam to close wounds. The medical version is called Dermabond. The chemical difference? Minimal. The price difference? Absurd. Clean and dry the wound. Hold edges together. The glue doesn't pull anything closed, you do. Apply a thin line over the closed seam, not inside the wound. Let it dry completely. Perfect for superficial cuts, split knuckles, and facial lacerations. But never put super glue inside a wound. It's cytotoxic to exposed tissue. You're sealing the surface, not filling the gap like colic. Isopropyl alcohol, the sterilizer. Every item I've mentioned depends on one thing: a clean wound. Honey on a dirty wound, infection. Glue on a dirty wound, abscess. 70% isopropyl alcohol kills bacteria, viruses, and fungi on contact. Sterilize your needle. Soak your floss. Wipe around, not inside. Wound edges before closing. Disinfect your hands. Wipe down your bathroom counter before any procedure. Keep in mind that alcohol in an open wound damages healthy tissue. Use it on instruments and intact skin. Flush the wound itself with clean water or saline. The emergency room was just a building full of people who understood 5 principles. Stop the bleeding, close the opening, kill the infection, manage the pain, buy the time. The building's dark now, but the principles didn't go anywhere. Your ancestors set bones with sticks and sewed themselves shut with animal sinew. They didn't have antibiotics or anesthetics. What they had was knowledge and the refusal to die quietly. That's your inheritance. Take inventory tonight. Move the honey where you can find it in the dark. Understand that every item under your sink is waiting to save a life. Because one day, someone you love might be bleeding on the floor, and you won't have time to order anything. You'll have time to reach under the sink, make sure you know what's there.